Okay, I see the number of participants joining quite stable, so I think we can start. Welcome everybody to this CMCC lecture, which aims to provide a dynamic platform for the international research community to discuss the latest advances in climate science and policy, including the state-of-the-art climate modeling and socio-economic outcomes of climate change. So today's lecture will be given by François Cohen, who is a CMCC Bassi Fellow and Associate Professor of Environmental Economics at the University of Barcelona. And François' research relates to climate change adaptation and mitigation in different sectors, but especially connected to the energy and health. He also contributed to more than 20 policy records and briefs for institutions such as the European Commission, the UNEP, the Green Economic Coalition, WHO, and the French and UK Ministries of Environment. And today he will discuss temperature, health, and adaptation, in particular, what actually protects people from these. Now, I would like to provide you with a very brief presentation of CMCC. So basically, Foundation CMCC is one of the leading research centers focused on the understanding of the interaction between climate change and society. We exploit a large network of associations and initiatives and institutions. I would name just a few of them, like the IPCC, the Integrated Assessment Modeling Community, the EIRE, which is the European Association of Environmental and Resource Economics, and much more, as you can see from this slide. What are the goals of CMCC? First, we aim to advance climate research through multidisciplinary analysis. We combine climate modeling, impact assessment, and environmental economics, and we also support science-driven adaptation and mitigation actions. To do that, we rely on three research institutes that aim to foster internal collaboration. The institutes are the Institute for the Earth System Prediction, the Institute on Climate Resilience, and the European Institute for Economics and Environment, which is where François was hosted during the Bassi Fellowship. We also have 4 strategic programs and a computing infrastructure dedicated to the study of climate change. And finally, we also take advantage of 2 specialized centers on digital innovation and high-level education and training. As I say, this is a CMCC lecture that is part of a series. If you are interested, you can so other speakers within this series were prestigious researchers such as Sandy Harrison, Weiss, Caputondi, and Reed. So you can access and read more about previous lectures in our website, and clearly there will be more and more lectures that are part of this series. Now, one final remark, this 1 hour is structured around a 35 minutes presentation from François. Then I will introduce Yaro, who is the discussant of this section. If you have questions, you can use the question and answer button that is provided in the Zoom link. So thanks everybody, and I hope you will enjoy this presentation. So François, please, the floor is yours.
Okay, well, thank you very much, first of all, to CMCC for the opportunity of having this conversation with everyone. and also, well, to talk about temperature health and climate adaptation, and with this talk about what actually protects people. So, as you know, climate change is already happening, and we're experiencing very severe heat waves around the globe, even in countries that didn't experience those in the past. So this is an image from the UK, which has experienced very severe heat waves, for instance, this year and also in 2024. So we're facing what is a new challenge. And this challenge is actually really complex because the magnitude of exposure and the number of people exposed is very, very high. And at the same time, we need to think about the interaction between the healthcare systems, which are already overstretched, and how they are going to cope with additional demand to basically protect people from health when they have a negative event that is caused by temperature. And also think about the integration with other systems to protect better people, for instance, enhancing our housing sector so that people are better sheltered. If you want I wanted to give you a few pictures about the magnitude of this problem. So right now, about half of the planet is already living in areas that are highly susceptible to climate change. And the WHO made a few projections about how many people could actually die because of climate change in the coming decades. And the number is really high. It's about 250,000 people that they estimated of additional deaths per year. And this includes only a few causes that they could track, such as undernutrition, malaria, diarrhea, and heat stress. And we know that these impacts will be very different for different types of people, because some people live in places where there is very weak health infrastructure. So if they have a problem, they can't really rely on anyone to help them. And in addition, they may not have the right adaptation strategies. They may not be able to protect themselves from the heat. So, and these two elements may compound and increase the health burden of climate change. So the good news is that we have solutions, and the solutions that have existed and solutions that we could design in the future. You may think about, for instance, air conditioning or urban greening, or a bit more anecdotally, if you go to the beach, well, you use sunscreen. So there are these solutions. And the question is, well, which ones should we roll out, and which ones are already available, which ones are not available, and how we can increase access to cooling. And in that regard, actually, there are limits to what we know in terms of what solutions works best and which people need them the most. And so this is some recent research done by other people that try to map out what we know and what we don't know in this landscape. And in general, we know, for instance, if you think about, for instance, there is a heat wave and many people are getting sick or ill. So when you look at national health statistics, there is a code for heat stroke. So that's directly related to heat, and it's quite easy to realize that, okay, well, these people have actually suffered from the heat stroke, and this is basically because it was too hot. But many diseases that develop during extreme heat are not codified as a heat-related disease. So for instance, people that have heart problems may suffer from a heart attack because of heat. And this additional heart attack is not going to be coded as a heat-related event. It's going to be coded as a heart attack. So it means that for epidemiologists and economists that try to quantify the health impacts of extreme heat, we need to be able to also quantify those negative events. And this is a bit harder, and it requires some statistical processing. But this is not the only problem. The problem is that some of these health impacts have not realized yet, so we need to assess the potential of who is going to be the most likely to be affected, to identify the population most at risk. And so we need to understand differences in risk levels across different types of populations. And there's a lot of heterogeneity there, naturally based on age, for instance. It could be also gender. It could be your capacity to protect yourself, but also simply your exposure. So if you imagine, for instance, construction workers that are working on big construction sites in the summer are particularly exposed. So we need to be able to map out those people. And as soon as we know what's the magnitude of the problem, so we would know who is most vulnerable, where they are, and what are the negative health events that they might suffer, then we need to start thinking about the interventions. And then the interventions, we don't necessarily know which works best for which people. So this is an additional layer of complexity to understand the health impacts of climate change and how to adapt. And finally, let's imagine that I know that there is an intervention that's very effective to protect people's health. Well, when I design a policy, so I can choose, for instance, should I design a policy that looks like a subsidy? Should it be the public provision of that good through direct government expenditure and this and that? And in that realm, there may be additional barriers or additional difficulties to reach people. For instance, maybe I design a subsidy, but people are not informed, and therefore there is no taker. So I need to account for all these elements, and they span from the epidemiology of it to the economics and understanding how people behave in general. So this is quite a complex problem. So to start with, I want to give you a bit of an idea of what we know and what we don't know as of now, so that we can have a discussion about adaptation more generally. So what we know very well is that we can quantify basically the impacts of the weather on mortality. And we can do this quite well because we have these huge statistics that are collected by most countries about mortality. So usually, unfortunately, when someone dies, there is a death record, and this death record is being filled, and we know when the person died, some basic information about their age, their gender, and we also know basically where they lived. So we can use this and collate information about the weather during the moment of their death to understand if maybe when it's hotter, there are more people that die. Okay, so typically, for instance, in Milan, where it was hosted by CMCC, there was a heat wave at the end of May, and the temperatures reached 35 degrees on May 26th. So we can try to look at what's the typical mortality level in Milan on a specific day, on a normal day, versus the mortality that we can record when there is a heat. So that's quite easy to do, and it basically uses this type of variation in temperature, so we can see, well, for instance, this is for the United States, so we can do it anywhere, right? And so it's when there is a peak in temperature, then we can look at how many people died, and when there's a low as well, so we can recover information about, in general, what's the trend, right? And what epidemiologists have been able to do quite easily, so this is something that I did, but everyone has done this for different countries and settings, is basically these curves. And so this curve is a U shape, so sometimes it's more like a J shape. And what does it say is that basically, so on the x-axis, you have different temperature levels, and on the y-axis, you have increases in mortality. So when the curve is at 0, so at the lowest level, this is the temperature level where you have the lowest mortality, and it usually is around 20 degrees. So in some countries, it's a bit less. In some countries, it's a bit more. But basically, 20 degrees is a comfortable temperature. And as soon as you go towards lower temperatures or higher temperatures, what we observe in these mortality statistics is that more people die. And when I say more people die, they don't necessarily die on the very specific day. Sometimes they get sick, and after a few weeks or after a few days, then they die. So this is why we tend to look at this over a longer period, typically 30 days, to be able to record additional mortality. So when we do that, we recover the impact of the weather on mortality. And the impact of the weather is very important because naturally under climate change, we know that there will be more hot days. So we know that if we have more of these excessive days, then we'll get higher mortality due to heat, right? However, it's very different from the impact of the climate. And the impact of the climate is something we know much less about. So imagine that, okay, there is a heat wave and unfortunately more people die. This is quite different because it's from understanding what happens if the weather is always warmer, simply because naturally, if you're more exposed over a longer period, maybe the health impacts are quite different from just being exposed a couple of days, right? So the climate change is going to shift climate patterns, And understanding these long-term consequences is much less understood, and probably not part of the 250,000 additional deaths per year that the WHO was capable of measuring. Another problem is that because these effects may compound, and because they are long-term, maybe we need to understand also the patient pathway. So let's imagine that I have a negative health event today. So for instance, unfortunately, because it's very hot, I get a very severe disease, such as a heart attack. Well, I may get this very severe disease, and it's weakening my body, and then I will have a much worse negative event following maybe in a year's time or in a couple of years' time. And this negative event is naturally linked to the fact that I had a heart attack today, right? So these type of things we are not very good at understanding and measuring, and we don't necessarily follow well people well enough, depending on the country, to be able to understand these things. And the last point is that temperatures today may not reflect the distribution of temperatures tomorrow. So maybe tomorrow in the UK, they will reach temperatures of 40 degrees quite often. But right now, they are not reaching those temperatures because climate change has not yet happened. So we can't measure the impact of temperatures that have not been already suffered or experienced by the people, right? And so that's actually a real problem for us because since the weather is increasing, we see that, for instance, this year could be the warmest on record. 2024 was the warmest on record. So we can't know, for instance, with 2024 data, the information, the death caused in 2026. And naturally, because it may mean that there are days that we have never observed. So that's a problem. To go back to long-term exposure. So there are a few things we know. So for instance, I talked about malaria. We can make predictions about what is going on when basically the temperature is getting warmer. So using information about the weather to understand mosquito populations and then make projections. So sometimes we can recover some longer term effects because we know that the mosquitoes, they can't survive very hot temperatures or they can't survive very cold temperatures. And so we can understand these shifts, right? And when it comes to long-term aspects, there are a few things we already know, which means that maybe we are already, this may be the tip of the iceberg, right? I mean, there may be much more problems, but at least we know quite a few. So for instance, we know that when women are pregnant and there is a heat wave, this affects babies in utero, before you're born, basically. And it can affect stillbirths. It also affects birth weight. And birth weight is quite important because it has been proven that it has very long-term impacts about the whole development of a person. And for instance, even educational attainment is correlated with your birth, your weight at birth. So we know that there will be these long-term impacts. We can't measure all of them, but we know what they exist. Going back to patient pathways, I said we know quite well what's happening with mortality. We know much less what is happening with what epidemiologists call morbidity, which is basically the health events that are negative, but that are not mortality, right? So if you get the flu or if you get really sick, this is morbidity. And what is quite interesting is that the mortality and the morbidity curves, they are not necessarily of the same shape. So to give you an example, with this study, we looked at the National Health Service and we produced a comprehensive analysis of different health resource use. So for instance, GP consultation, laboratory testing, prescriptions, if you need a prescription for a doctor, or in emergency. So if you have an emergency, you'll go to a hospital, then we could look at this. And down there, you have basically the number of deaths and this form of U-shaped relationship that I presented before. And you can see that on very cold days, so this is not, but on very cold days, there's quite a high mortality in England. And the thing that I want to point is that whereas we see very high mortality, we don't really see people going to see their GP or asking for more prescription or going to hospitals or going to A&E. Actually, this is a moment when people don't go and they don't come. So the mortality is very high. But the use of the healthcare system is not that high. Maybe because people don't want to go. It's quite cold outside. Maybe there is snow. Maybe it's not convenient. For X, Y, and Z reason, they don't come. And that makes me think about this mismatch that there could be between actual risk and exposure to the worst of the worst, right, which is dying, and the use of services or the potential to reduce these mortality impacts, maybe because people could have gone to see the doctor and maybe this would have ended up in death. So there are still many things that could be avoidable, even in a high-income country, and even in a high-income country that is used to exposure of a certain kind, in that case cold. More broadly, we know that there is a gap in terms of in terms of the mortality impacts of temperature for different types of population, especially between the rich and the poor. So that's about Mexico. And in here, so these quartiles are quartiles of income, meaning the first quartile of income are the poorest people, and Mexico is very unequal. So the poorest people in Mexico don't have good living conditions. Very often they live in slums. And the fourth quartile, where in contrast, people have very good standards of living comparable to European standards. And the curves are not entirely, I mean, looking at both curves, you may need to take a couple of minutes to realize, but actually the first curve is more of a U shape, and the second curve for the fourth quartile is flatter. And the difference when you compute those things is about 40%, meaning that if you're poor, you're about 50% more likely to actually die from cold in that case, and also from heat. So there is a real difference in vulnerability. And that makes me think, okay, so since we know that, we need to act. And to act, we need to adapt, which means that we have a huge challenge, which is to understand how we should adapt. An interesting figure was done by the US researchers and people like Tama Carleton, who looked at, okay, so with all the evidence that I presented you, everything that we have, we look at all the countries and so on, what do we know about the current mortality trends and the extent to which they are associated with income and different types of adaptation. And what they basically find is that thanks to economic progress, people becoming richer, probably they will adapt by themselves and they will be more robust. But there is also a need to plan for adaptation. And these two things are essential because they can actually really shelter us from the negative effect of heat. So we need to plan for these things because there are lives to be saved from adaptation to climate change. The problem is that we don't know how. So the evidence about the adaptations that work and how to roll them out and so on, it's not really there. And I want to show you why quite briefly, and then we can talk about different solutions, right? So the first thing is that actually it's hard to understand their potential, and I'm going to explain why. And it's also hard to understand what are the exact mechanisms, so through which those adaptations may protect us or not from different types of diseases. And when it comes to designing policies to roll them out, we don't know which one to roll out, or we don't know how effective they are going to be. There is very little cost-benefit analysis that are robust about this type of interventions. So why is it so hard to look at adaptation? And the problem in statistics is what is called reverse causality. So imagine that I'm very weak, for instance. Well, I will try to protect myself as much as I can, right? So for instance, maybe I'm very, very sensitive to the sun. So I'm going to use a lot of sunscreen. If I go to the beach, I'm going to have an umbrella. I'm going to have sunglasses. I'm going to be covered from head to toe, right? And so what you will see is that actually I'm really, really covered. And despite of this, despite of doing all these things, maybe I still get sunburned because I'm so sensitive to this that I may have forgotten a little patch of my skin and then I get sunburned. In contrast, some people, let's say, are a bit luckier, and they are not that weak, and they can be exposed to the sun for much longer because their skin is different, and they don't get sunburned, right? So when a statistician looks at this, if they try to compare those two people, naturally the benchmark is wrong, and what they may find is that the people that protect themselves the most are also the ones that suffer the most and have the most negative health events, which means that we can't do these comparisons because actually what we would need is people of equal vulnerability, but people of equal vulnerability may take the same measures, right? Another problem that we have is that sometimes information is incomplete. So in all the things that I've said, for instance, I may not have taken into account that some people may go to the beach, where some people may not go to the beach, right? And so when I look at the effectiveness of protection measures, the problem is that maybe there are a lot of people that won't even go to the beach. And for these ones, I don't even have any information. And the third point is a bit related with the other two, is that there are many adaptations. So if I want to understand the impact of sunscreen, I also need to separate it from the impact of having an umbrella, or the impact of not going to the beach, or the impact of this and the impact on that. And that makes the case for different types of adaptation much harder to make than, for instance, looking at the simple association between mortality and temperature, the way I presented it. So to show you how complex this is, so there's the beach example, but here is the housing example. So if you think of your house as some structure to protect yourself from cold and warm temperatures, you'll soon realize that your house is quite complex. So in here, we have separated 11 types of things you could do, but actually there are much more. You could imagine that there are about 40 or 50, in fact, which is basically maybe changing your doors and windows to insulate your house better, directly using insulation, using different types of equipment, so for instance, heat pumps or different forms of heating or cooling systems, changing your roof, changing the whole facade of your house. So many things you can do, right? And when you do those things in addition, sometimes you may use those things and sometimes you may not. So for instance, you have an air conditioner, well, maybe you use it and therefore you use a lot of electricity, or maybe you don't use it. So then there is also the question of how much energy you're going to use, how much water you're going to use if you happen to have a swimming pool, and so on and so forth. And if we want to have the full picture about adaptation, we need to track as many as we can do so that we understand trade-offs and substitutions. So in this paper, for instance, we show, which is a bit obvious after when you say it, is that, for instance, when it's warmer, people tend to use electricity, but they also tend to use gas less, because gas is mostly used for heating and not for cooling, right? But it means that the cost for them is offset. So to an extent, for instance, we can pay for temperature adaptation in the summers that are going to be very, very warm, with reducing the need for other adaptations in the winter. So there is this possibility. All the issues that I mentioned about measuring these things, the complexity of the different types of adaptation and so on, they are compounded when we go to low and middle income countries. They have high exposure to extreme temperatures. They have lower capacity to adapt because they have less money, and also because their governments are also less rich and have less capacity to leverage funds for developing infrastructure for everyone. And the data is scarcer than what we can have in high-income countries. And for these people, the need is more urgent, and we need low-score scalable adaptation strategies for which we have very little information. So that's the challenge. So it's not because something is challenging that we should abandon, naturally, because the stakes are too high, right? So the question is how we build the evidence from there. And I will take you onto the journey of some of my colleagues about building the evidence for cooling, what we know, what we still don't know, and how we could do things better, right? And in that case, what is quite important is to understand that people have been looking at, for instance, air conditioning. And we already know from the information that we have that in places where they have air conditioning, they die less of very extreme heat. And this has been shown for the United States. This has also been shown for India. The information is mostly what we would say correlational. So We don't have perfect cases where we can compare people, but we know that in general, when there has been diffusion of air conditioning, people die less. And therefore, there is quite a strong case for air conditioning. We also know it in schools. So there is a paper that looks at SAT exams, so which is like when you graduate from high school in the United States, you take this big exam, right? And we know that the people that graduate, you're more likely to graduate and have a good grade if it wasn't too hot. And if it was hot, if you were in a school that had air conditioning. And so that also gives us an idea that air conditioning naturally has an impact on health and has a global impact on your body and your capacity, for instance, to focus on concentration. So in that case, there's a strong case to say, well, you know what, we need to develop cooling solutions because they have health impacts. Naturally, the problem with air conditioning is that it comes with real drawbacks. So the problem is that most people can't afford it. People in low and middle income countries, they very often don't have a refrigerator. So they're not going to have an air conditioner that's more expensive to buy and to run. And it's also very polluting. And right now, so for the cooling sector, the estimates are that cooling represents about 7% of global emissions, which is more or less, a bit less than agriculture. And by 2050, this could triple to about 20% of all global emissions that will come from the cooling sector. So clearly, this is going to be a huge problem in the future if we do these types of adaptations where we put air conditioners everywhere. So we need to think about, well, since we can't really put air conditioners everywhere because it's too expensive and because the most vulnerable people are not the ones that are going to use an air conditioner anyway, we need to think about other forms of adaptation. And for instance, in high-income countries, what is often very useful, but not necessarily done, is to combine air conditioning with fans. Because we know that fans can cool you out. And if it's very, very hot, then you add an air conditioner. But an air conditioner plus a fan is actually much less energy consuming than just the air conditioner. And so this is, for instance, to give you a possibility of the things we can do. And basically, when I start saying this, you start maybe saying that actually cooling is more a system than a technology. It's about cooling people and understanding all the things you can do and that can be stacked up to reach the comfortable temperature level that you want at the lowest cost that you want and also at the lowest environmental cost that you want, which means fewer emissions. And to do so, you need to start thinking about passive cooling solutions, which is basically shading, ventilation, better insulation, increasing the energy efficiency of buildings, and reducing also the worst of the environmental impact of cooling, which come from cooling refrigerants, which are very, very bad for the environment because they basically contribute a lot to climate change, especially when there is leakage. So if some old appliances get dumped, most of the time in low-income countries, and from then you have leakage of these gases that are really bad for the environment. So if we did all this, we could actually achieve much more. And so it means that we need to do all this, and we need to start from the real needs of the people. And for that, we need to start listening maybe more to people. And so we have developed a few projects to understand, well, how we can bring energy solutions to African countries, looking at what were the benefits of off-grid energy, and basically trying to understand who was benefiting from those technologies and how, and so on and so forth. And we find, for instance, that the simplest technologies very often bring the highest benefits. So typically, a little solar lantern, when you don't have anything, it brings you a lot of benefits. And so we may need to we may want to start from the simplest solutions, for instance, a simple lantern or a simple fan, before moving to the complex solutions, which would be a complete integrated system between air conditioning and ventilators. And also, there's another study that we did about refrigeration, because half of cooling is actually cooling your food, and it's about refrigeration and supply chains in refrigeration, and not so much about temperature cooling. And in that case, so it's quite overlooked. And what we found for Ghana is that when we had information about refrigerators that had broken down. So in some households, they had bought the refrigerator at the same time, and at similar prices as in other households. But unfortunately, the appliances had broken down. So we can compare these similar households between the lucky and the unlucky ones, and therefore check basically what's the impact on their lives. And what we find is that they are more food insecure, especially because they can't access certain foods anymore. Because when you have a refrigerator, you can store, for instance, meat, you can store dairy, you can store eggs, which means that you have a wider portfolio of food items you can actually eat. And for these people, it may mean that ultimately their nutrition is impacted to an extent that is quite important. So if you think that animal source products are the only ones that have vitamin B12, which is very important for pregnant women and a very essential vitamin for all of us anyway, it means that if they can't access this, you will have vitamin deficiencies that are quite bad for pregnancy. So I will very shortly conclude about, okay, understanding, well, what could we do to improve this cooling system? And we need to move from the evidence, as bad as it is, to policy. And there, I think that's where things have been the most missed, in my opinion. So here's a terrible map. I'm sorry for the very bad resolution of the map. But what the map is intended to show you is basically if we have 3 different types of cooling policies around the world in 193 jurisdictions. And the first one is an agreement about cooling refrigerants. And this is the orange dot, and some countries have it, some countries don't even have it. So they didn't even agree to sign something to say we should stop having this terrible leakage of this terrible contaminant. And the other ones are what we call minimum energy performance standards for appliances. And typically, as you can see in Africa, they don't have those, meaning that basically you can sell to people whatever product, and appliances with lower running costs. And the other one is building standards, so that we make sure that the buildings are built properly. And again, in many countries, we don't have those. And what this map is hiding furthermore is that in some countries where we do have those things, especially in the European Union or in the United States, we don't necessarily have the best of those policies at all. So for instance, when we put standards on appliances, we may not update them, meaning that you put a standard in the early 2000s, then there's technological progress. Nowadays, we can do much better, but you haven't updated it for the past 10 years. So your standard is outdated, meaning you're allowing low efficiency products to be sold on the market, whereas you shouldn't allow them. So there is a need to increase the visibility around those policies and the priority that we give to them. And as we do that, we should also evaluate which policies work best. So here, this is for energy efficiency. So like improving the general quality of your house. And there was a huge program in France to retrofit homes. And what we found is that a lot of the money that was supposed to go to people, they actually went to installers of those things, because these installers, they have a local market power. So there's 1 or 2, for instance, in an area. And so as soon as you give a lot of subsidies for energy efficiency, they raise their prices. And that creates, for instance, inefficiencies in the rollout of those policies. So that's all that I wanted to tell you. And I hope we can have a very nice conversation about this in the coming minutes. And I thank you very much for your attention.
Thanks, François. Very, very interesting. Okay, so I would like to introduce you to Jaroslav Misiak, who is a principal scientist at CMCC and is founding director of the research division Risk Assessment and Adaptation Strategies. I think Jaro might have 1 or 2 questions to start the conversation, and then after François answered these questions, I can read some questions that are provided in a question and answer session.
Yeah, thank you very much, Christina and François. Can you hear me well?
Yeah.
Yeah, lovely. I enjoyed your presentation. It was really nice. And what particularly struck me is the paradox that you highlighted, right? Well, we are becoming increasingly aware about the health impacts, although you mentioned it's not straightforward. But we know relatively little about the adaptation measure, how they actually work, for whom, and under what conditions. So it seems to me that the next frontier is not only to improve our capabilities on risk assessment, but also strengthen the knowledge and focus on the effectiveness of adaptation and the distributional consequences. And this is in the RAS division, Risk Assessment and Adaptation Strategies, which I work in. We are doing that, and this resonates heavily, right, what we are doing. So the traditional risk assessment that we are doing, we are trying to bring it closer to the subnational governments, like local regional authorities. This is part of the Mission Adaptation Project. At the European level, we are looking at the different climate risk, including extreme heat, as a source of systemic risk. And that's very interesting. So we are sort of trying to look beyond the risk and incorporate the principles that the risk is only useful if it also highlights how to reduce that. And that brings me to the question that I would like to ask, right? In the European Climate Risk Assessment, we looked into inequalities and how inequalities might compound and eventually make the problem worse. In your case, I would like to ask, you have highlighted different inequalities, but you have not explicitly mentioned the gender inequalities. So you have showed that some people are much more vulnerable to heat than the others, and then also they have a different access to the adaptation, and that's really good. And we often talk about the age, income, or health status, but much less about the gender. So can you elaborate a little bit about whether you have done or what is the state of the literature on how the health risk and the heat risk and the heat adaptation measures might produce the differentiated impact on inequalities, and what are the risks there? Thank you.
Yeah, I think the reason why the literature mentions above all age and income is because for these things, the association is usually very strong. So for instance, infants are really vulnerable, and the elderly as well. So we really see that if you are fairly young and in good health, let's say if you are in your 20s or 30s, then you will be, in general, you will be fine. But at as soon as you reach 45, 50, we start seeing negative health events from heat. And the same for income. There are very strong differences, especially if we go to low and middle income countries. For gender, I think what is quite important is that it really depends on the context, because some populations, for instance, men that work in the construction sector are going to be much more exposed than anyone else that don't work on the construction sector, right? And very often this is a male-dominated work environment, and those people, for instance, then are particularly vulnerable. So I think there will be associations with gender depending on the different things that we look at. I think the way the epidemiology literature has been trying to push is to look at what they call comorbidities. So for instance, imagine that you have already a pre-existing condition. So for instance, you have had cancer, or you have hypertension, or you have diabetes. These things put you at very, very high risk. And naturally, it can be that you're a woman or that you can be a man. Some of these things may correlate with gender, but I don't think that the reason why we haven't really explored this as much, I think, in the health sector is because when we look at things, it's actually a bit, I mean, both men and women can be negatively affected by this. However, where I think that there are a few more things where there may be inequalities between men and women, and where women are at a disadvantage in this space, is about access to adaptation. And in that case, it's not always clear that women have the same type of access. when we looked at off-grid energy solutions more generally, so not necessarily temperature related, but also off-grid energy more generally. In fact, in the data that we have, it's 65% of men that get them and 35% of women. And in general, we would find this type of thing. So when women are poor, for instance, or when they don't have the decising power in the households, then they are less empowered to adopt the right types of adaptation for themselves. So I think that's where we could find quite striking differences, and where it would be quite interesting to see what works for different types of people. Maybe also the adaptation of different technologies would be very different between men and women.
Lovely, thank you very much, Ella. So I would have many other questions, and I'm sure we will have the opportunity to talk bilaterally, because I've seen that there are many questions in the Q&As. Christina,
yes, indeed, yes. I was about to suggest that maybe I give the room to the other questions, and in particular, I noticed that the first question is a little bit related to what you just discussed, which is about how, so it's the matter of heterogeneity of the impact. So the question is how, if it's possible to compare the health impacts across different regions or across different populations, or maybe there is something that prevents the research to do that, because maybe given that different populations have been experienced, you say that, it's a long process. And so if some population were exposed in the past to different factors, maybe it's hard to compare. But that's the question. So if it's possible to compare the health impacts across different regions or different populations.
Yeah, I think it is possible, but the quality of the evidence needs to be also considered. So in economics, we like in epidemiology, we like experimental settings. So you take exactly somehow the same type of people and you expose them to the same thing, and then you say, you know what, based on that evidence, I can say that this intervention works, this intervention doesn't work. But in the real world, we don't necessarily always have that level of knowledge, right? So I think we should always use the information that we have. We shouldn't say, oh, because it's not the gold standard of how we should analyze things, we should never use that information. But when we use it, we need to know the limitations. So naturally, if you're comparing two different populations, the reasons why these populations are different may explain why you find a different result. In general, we know that in poorer countries, relatively, when there is a health shock, for people of the same age, if you're in the poorer country, you're more exposed and you're going to suffer the most. Naturally, it's not exactly the same when you compare populations that are much younger. So in low and middle income countries, sometimes populations are much younger than what we have, for instance, in Europe, and therefore the impact is lower in a low income country compared to a high income country, simply because I'm comparing 30-year-olds with 70-year-olds, and this can't be compared.
Thanks, François. There's another question on air conditioning. So you say that it's an important adaptation strategy, but we all know the implication in terms of the greenhouse gas emissions of AC. So do we really think that AC is the solution?
No, I think AC is more the problem than the solution. But I think in here we can separate what is maybe good for someone, and good for society in general. And these are two different things, right? So maybe for me, it's quite nice, to have a villa and a swimming pool, and why not plenty of ACs everywhere? It's very comfortable for me. The problem is that we only have one planet and we can't do this for everyone. And on top, we don't even have the money, and we know that people can't do that. So I think that's where it stops being a solution. It falls short of being a solution very fast. So naturally, you can say, well, but we can have, for instance, in places where you have air conditioning, maybe you can have you can have solar energy fueling these air conditioners, but also it can be very inefficient. So even if, let's imagine that I quite like air conditioning because it's very comfortable and so on, I mean, it cools a room. But actually what you want is to cool yourself, not to cool the room. I mean, you have no interest in that. So that's where, for instance, I don't think that air conditioning is clearly the only solution. I think, for instance, so what I mentioned, so if you have fans, you can be at 27 degrees or 28 degrees, but with a fan, you're actually feeling comfortable. So that's where I think air conditioning falls short. But ultimately, I think what we are going to see is hopefully the rollout of plenty of solutions. So not just say, oh, you know what, let's put air conditioners everywhere, but maybe solutions that are also adapted to your need. If you're 30, maybe you don't really need air conditioning all the time. But if you're already in your 80s and you're already very vulnerable and you have health conditions that are really bad for you, then naturally we want stronger solutions. And I don't know, because we don't have the information. I can't even know if air conditioning is the right solution, because air conditioning modifies also the humidity in the environment. It does a lot of other stuff. And right now we don't have the evidence to say, you know what, you should do one thing or the other. So it's even very difficult to say what are the health impacts of air conditioning. But we do know that based on the information that we have, in a world with air conditioning, the temperature vulnerability of people seem to be going down.
Okay, thanks a lot. And now there's a questions on epidemiological studies that they tend to observe that the impact of heat stress is correlated with the GDP, but in a positive way. So there are examples that, and that's because, for example, the heat island that happen in cities are particularly detrimental for wealth consequences. So can you say something about these studies that observe that regions with higher GDP are those with higher heat-related mortality?
My guess, I mean, it's difficult to talk about studies without reading them, right? I mean, so but my guess is that it's an age thing. So in the studies that I did, when you reach 65, then you become really much more vulnerable. And so that the age matters a lot. And therefore, if you compare a country whose population on average is 25, with a country whose population is aging, you'll find this difference. And in general, because of how demographic transition works, the countries that have a younger population tend to be the poorer countries, so lower GDP per capita. So that would be my guess. But that's maybe only my guess, and maybe I'm wrong. You know, I mean, it could be something else. When you tend to control for that, when you control for age, in general, if you live in a slum, I can guarantee you that the health impact is higher, simply because so in some slums in Latin America that I know a bit more, when the temperature can reach 40 degrees, 50 degrees, because you have this metal rooftop, which is really bad, and so inside it's unbreathable. And then if you live very far from a health center, or if health centers are overstretched, you may not be able to get access to care. And in that case, the situation is much worse.
Okay, yeah, very, very clear. There's a question about, I mean, a possible integration of adaptation measures in city planning. Are you aware of any?
Yeah, so this is a big thing. And that's also, like right now, a lot of money is going into adaptation. Sometimes you know where to spend that money, sometimes you don't. And that, I think that's the reason why also I was pushing to say, well, we don't know that much, and we need to know more, because we could do things probably better. But right now, for instance, I mean, I live in Barcelona, which is a city that is very active and trying to do a lot. And I can be very grateful for them in terms of, for instance, having better trees. So because we know that tree cover reduces the heat and so on. And those people, they would be eager to have information on the health impacts of all the things that they do, but they don't, because there is no evaluation right now of these things. So we want to try to support them, but it's also difficult, because as soon as the intervention is social, then you need to know who is using those this infrastructure. And very often you can't really match it with health data, which means that there is a missing information link there that prevents the analysis to be done. But yeah, city planning is a big one. Because in fact, sometimes it would be much better and more efficient that we do things jointly than trying to install air conditioners individually in our homes and just increase our energy bills.
Thanks. Then there's now a question on possible adaptation strategies. You talked a lot about technological or also policy-related instruments, and you just quickly mentioned about behavioral responses. So the question is whether you can make examples of possible behavioral responses, or maybe studies that try to test the effect of such behavioral responses.
So one thing that I find a bit strange is that in some very hot countries, people use suits to go to work, and it's like 40 degrees, and they are working in suits because when they go in the office, this is a very air-conditioned environment. And that for me is a double inefficiency, because I don't really think that these people really want to wear a suit, but maybe they do. I mean, I don't know. Personally, I don't really like the suit, but I'm not too sure that they want to do that, but they're still doing it. And at the same time, then the environment needs to be completely cool. So this is pure behavior, for instance. And we could imagine that if we changed the way we perceive what is professional and how people should dress to look professional, then maybe we could actually reduce heat. Another type of behavior that could really help with the problem, for instance, would be to understand, well, nowadays, for instance, we can all work from home. So it would be interesting to look at, I haven't done this, but I think some people have looked at the energy consumption that this implies, and we should avoid, for instance, double use of energy in our workplace that is air conditioned, but we're no longer working there and at home. So these are the type of things that we could think about.
Okay, there's one clarification question about one figure you provided about the increase in greenhouse gas emissions by 2050 because of cooling. Michele asked whether this figure refers only to cooling for people or also cooling connected to computers, architecture, powering connected to AI.
Yeah, so it's the cooling sector as a whole. So it includes a lot of things. So it's not only cooling for people. I believe it is cooling and refrigeration. And it's not only greenhouse gases, it's also refrigerants. Because when you have refrigerant leakage, it's actually about a third of the greenhouse gas potential of cooling appliances. So that, so the report is the UN Global Cooling Watch report.
Okay. And then about behavioral responses and the opinion of people. So you mentioned it is really important to listen to what people think and how they react. So Julia is asking whether you plan, and if yes, how you want to incorporate in your research, in your future research, the behavior of people and their desire.
Yeah, so we want to do research in the field. So basically, for instance, well, some people at CMCC have done that, and I think it's very cool. For instance, there are now climate shelters that cities are considering. And we want to understand why people use those shelters or not. And so to go back to behavioral intervention, so the person, Katarina Mindo, has found about this is that basically sometimes people, they think that other people are vulnerable. So, I mean, so you never think that you are going to suffer from it. It's like, oh, okay. And even people that you would think are vulnerable because of what I said, like pre-existing health conditions and age and so on. And they are going to tell you, oh, no, but I'm fine. But it's very good that you do it because other people are vulnerable. So we have this type of new information that comes in. And as soon as we understand that, for instance, we ask, well, okay, we are going to build these shelters, but are people coming in? And the type of things that this type of research can help understand is how you make people come to a cooling shelter if a cooling shelter is useful. And basically, it's usually not only a cooling shelter; it's a place for socialization. So because if you're dealing in a high-income country with an aging population, their need is not necessarily only cooling; it may be a lot of other things. And for instance, we have a loneliness crisis in high-income countries, so we could think about those things jointly rather than separately. So sometimes this is the type of things that we want to do. So go more into the field. It's also more expensive, which means that researchers like me, we sometimes get a bit some limitations to do that. It requires higher coordination, but this is, I think, a very interesting area for future research.
Okay, for time constraint, I will only read one additional question. There are much more. So either we can ask François if you agree, if they can send you an email with the questions that we were not able to cover, or they can simply write to the CMCC channel, which is info@cmcc.it. So we can collect the questions for you, and then we will send them. But the final question could be whether we could learn from adaptation approaches taken by authorities and communities from other vulnerable regions. So do you have a suggestion? Do you have ideas or examples in this context?
Well, first, people can write to me. So it's françois.cohen@ub.edu. And we can definitely learn from other regions. So I think that what we've been trying to do with different people is actually to do these studies. So starting with the mortality and temperature studies, to do them in many, many different places, so that we can compare things and learn from the existing evidence. And then I think that having some regional perspective can help. So some countries are more comparable than others, and sometimes that may help. So for instance, typically, since CMCC is in Italy, and a study about Spain is very often useful for people in Italy and in general in the Mediterranean region. Likewise, for instance, the results that we find from Mexico are probably extrapolable to Central American countries.
Okay, thanks to both François and Yaro. Thanks for the organizer, and I think we can close the session here.
Thank you very much, Cristina and François.